It's no more public secret, and the government has said it openly. On the 12th of March, 2025, the UK government actually said something that is quite significant and of interest of us as immigrants, as care workers in the UK, guys. No wonder why I thought, well, let me do justice to this by sharing with my people my thoughts as far as this is concerned. And this is with regards to the new rule regarding employment of international health cares workers from abroad on sponsorship. So in this video, I'm going to be sharing with you what the minister said, when they will be implemented. Obviously, I'll also weigh in on what I think as far as people that are in this country, what they need to do and what it means for them. And also I'll weigh in again on what it means for people that are abroad. Guys, a big welcome to our YouTube channel. My name is Florence, and for those of you that are watching me for the first time, please forget to hit the subscribe button. We are on a road to 3K and we cannot do it without you. What that means is when you subscribe, we reach more people with the diaspora journey, relocation, making it possible for everybody, sharing information on the diaspora journey, successes, struggles and opportunities also, not just for the UK but everywhere else abroad. So guys, do subscribe and also put on the notification bell, and don't forget to like our videos because that's how we get to reach so many people. So guys, I won't waste much of your time. I'll get right straight into it. So what happened is, apparently the health care worker visa or skilled worker visa has been there since 2019, just after COVID, whereby it was allowing UK registered companies or companies with sponsor licenses to actually recruit international care workers, caregivers, support workers from anywhere else in the world on a sponsorship visa. Companies could issue a 1-year visa, 3-year visa, 5-year visa. This was so beneficial for the healthcare system in this country, as it was shared by also the minister in an article that I'll share with you on this video as well, where he appreciated the input that was being realized when they started this program. However, it's been topical. The immigration issue in this country has just been topical. Other circles are not happy, others are happy, but it's been talked about. There is no way that they go to the parliament and they're not talking about immigration numbers and stuff. So the government has been implementing a number of measures, and I've tried each time that they bring up a certain measure to keep you updated. No wonder why, if you're interested in this, please do subscribe and stay on this channel. So apparently they realized that ever since they implemented something last year, where they said care workers on no code 6135 and 6136, which is senior care workers, could not bring their dependents to this country. Also, this applied as well to people that were on student visa. And guys, I don't want to lie to you. They've realized a significant drop in numbers of people that were applying for visas to come to the UK. And I do remember I shared a video where they actually said the number was standing on 490,000 visas less compared to when they were allowing people to bring over their dependents. So apparently all the measures that they're bringing into place are actually working. Actually seems like they are getting a grip on immigration. But guys, I know some could despair when they hear this, but I'm not despairing. I'm sort of a bit excited. Why? I'll share with you, because as you know, I'm the diaspora journey. I'm for relocation. I always share and encourage people to say, if you think relocation, please give it a go, because it could change your life. It changed mine. It changed my family's life. So it's something that's worth giving a go, especially if your situation or especially where you're coming from is like where I came from. So what gives me joy as far as all these implementations are concerned is the fact that they are not saying they are scrapping the visa route altogether. So it gives me joy, guys. It gives me a bit of hope and positivity, and I want to impart the same to you if you're watching this video. So apparently the new rule is that companies or organizations in this country are supposed to prioritize international healthcare workers that are already in this country when they recruit. So what that means is, if they've got a vacancy, they have to make sure they've advertised, they have actually prioritized recruiting from this country before they can then take someone from abroad. Guys, I want you to see something. Keyword is to prioritize recruiting international care workers already in the country. So they didn't say they allows only for employing people that are in this country. So what that means is, if they have prioritized and they have not got the responses that they need, if they cannot find someone to fill in that vacancy in this country, what that means is they are allowed to actually recruit from abroad. So this is good news for somebody who is abroad. And I want to encourage people to say, do what you need to do, gather all the documents that you need, and keep applying. I'll also share with you why I feel this visa route is going to be around for a very long time. I don't think they're scrapping it. I think I'll actually make a new video and on this one, because this is in light of all the other countries that are actually coming up with a care route for their countries. And so that places this country in sort of care workers, and it is what it is. So they cannot obviously scrap it altogether now and in the near future. That's just my thoughts. You can also share your thoughts in the comments and we can have a conversation going. So obviously some of you could ask, like, so do they implement this? This is coming into action on the 9th of April. I've had a lot of people really do reach out to me in my DM and everywhere else on my social platforms to ask, so what does it mean for me? I had applied for my visa, or I'm waiting for my COS. I think if you are at that stage where you're waiting for a visa and the process is at where it is, there's no need for you to panic. I'm sure you will get your visa, because the rule has been implemented when you had already started your onboarding process. The system is fair like that. And what does this mean for? A lot of people were saying, so does this mean the route is closed or it's pointless for me to go and write my IELTS? I don't think so. I would still think go ahead and do what you need to do. And I will explain at the end of this video why I still feel people that are still abroad do stand a chance. I'll give my own analysis and you will see for yourself if it's for you. So obviously some people would want to know, why have they all of a sudden decided to do this? I shared before to say this country very big on numbers. They analyze data, they analyze numbers, they work on numbers, and they decide based on numbers. So some of the reasons that I came across when I was reading on the website was that obviously they noted a lot of unexpectations that were going on as far as this visa route were concerned. They were not happy. People were being exploited, modern day slavery, people were being abused, and it's not something that they expected. And actually they went on to say about 470 sponsor licenses were revoked. So what that meant was 470 companies had brought people to come and work in this country, and they were exploiting them. They were asking them to pay for costs and things like that. They were working under conditions that nobody should work under. So they revoked their licenses. But what that did is, according to that website, is it left about 39,000 people out of jobs. Now, 39,000 people is not a joke. Obviously, it made them to decide to say, what are we going to do with 39,000 people? And they threw a lifeline. This is a lifeline. If you're watching this video, or if you're watching this video and you're in a situation where your sponsor license has been, as your company's sponsor license has been revoked, you're watching this video and you know somebody whose license have been revoked, please do share with them. Because what that means is this adjustment or this rule is specifically to target those people, not for them to send them back home, not for them to deport them, but to say there is a lifeline. Find an organization that wants to employ you. There is a lifeline. Companies have just been told to prioritize those people that are already in this country, regardless of whether or not the organization they used to work for have had their license revoked. Of course, it will come with a lot of legalities like that. So just do what you need to do. I would encourage for people to wait until maybe the 60 days period have actually run out. But I would say as soon as you had their sponsor license revoked, definitely start looking for a switch. I'm an advocate for people switching jobs. I'm an advocate for, if you're not happy where you are, if you're seeing some red flags, definitely there are organizations that are willing to absorb you and you will enjoy life in the diaspora. Guys, I cannot have a conversation on care workers and what they need to do and not talk about the NHS and lately jobs in councils. I've shared in videos why somebody needs to work for the NHS, why somebody needs to work for councils. And I think with these changes, definitely this is like to say the NHS agencies, NHS trusts can now massively recruit in the pool of international care workers that are already in the country. And I'm sure they will make use of this opportunity. I'm sure they will not let this opportunity pass them by. So it's going to be a race really between employers, between organizations to say, how best can we maximize on this role? How best can we really maximize and get the best out of this role? Because we don't know for how long this role is going to be there. We don't know. And well, they said they will bring to light as the year goes on, the plan for change as far as immigration is concerned. So guys, I'll talk briefly what I think, and these are my thoughts, guys. Disclaimer, I'm not a representative of any organization whatsoever. So what happens is, of course, most organizations are going to start recruiting. And I've seen a lot of recruitment events coming up. I've seen a lot of organizations recruiting, and they're specifying that they're recruiting within the country. So it means like a lot of jobs will be going. So you'll be spoiled for choice. But obviously what that means as well is, guys, we've seen a rise in people joining the NHS, people joining councils. Obviously for reasons that I've always highlighted in most of my videos. But what does it mean for that small employer out there? Does that mean they're going to close their business because their employees are switching? What that means is they will always be, when something like this comes up, and they'll always be desperate, and they will then come up with evidence to say, we are advertising, we had recruited, but people have been leaving for other organizations. So obviously they'll be left with absolutely no choice but to recruit abroad. That's the good news that I was saying. I still believe people abroad do stand a chance. For as long as they would have said, we have brought an end to this visa route, definitely there will always be a way of coming. Of course, this is not just affecting people that are on care visas or senior carers. No, it's also affecting those on short-term study visas. Obviously, it has come to light that people would come on those visas, but not specifically for studying, but either to come and work illegally, either to come and then not go back, seek asylum and things like that. So definitely they're tightening the screws on these routes. But guys, I'm an optimist, and I'm always positive. I'm always looking for opportunities and that tiny glimpse of hope. And guys, I still have hope. I still am hopeful. Why do I say that? I say that because obviously the immigration system in this country is a 5-year route, 10-year route, things like that towards citizenship. So guys, what happens? This visa was opened in 2019. What that means is people that came in 2019 are now eligible for their indefinite leave to remain. So if they are eligible, what that means is as soon as they get that, then they will then are allowed to work anywhere. They are not bound by any sponsorship rules. So those people can actually either leave jobs that they're working at, choose to study, things like that. So who is going to fill in that gap that they leave? So I don't see it going away. I see it as a route that's going to be there for a while. And if you're watching these videos, this video overseas, guys, still do continue to do what you're doing. Do continue to put in place those documents. Of course, one of the questions that I always get asked when I put out a video is, what documents do I need? Do I need the IELTS? Yes, I will give you a rundown of all the documents that you may need. And this also goes out to people that are actually in this country. You could be a dependent, guys. This is also a message for you to say, now organizations are allowed to recruit, and you can actually go on your own certificate of sponsorship, because they have been actually, told people already in the country. So why shouldn't they give you your own COS? But there are things that you need to do first, of course. You need to have your IELTS General, IELTS UKVI. You need that. You need to have your TB test. But of course, if you're already in the country, what it means is you've already done your TB test, so you don't need it. You don't need your police clearance if you're already in this country. So the only thing that you require is your IELTS UKVI, your certificate of sponsorship, and then you're good to go. You're good to have your own COS and avoid all this back and forth that's happening in our communities. But if you're still abroad, these are some of the things that you need to prepare. You need to have your IELTS General or Academic UKVI. You need your TB test, which you have to do with IOM, not just any other hospital whatsoever. So you will be directed. You need your police clearance for the country that you're a resident or a citizen of, or any other country that you have lived for more than 12 years in. So you need a police clearance for all that. Of course, you need your passport. Your visa without a passport. You also need some of the requirements that are coming up are employer-specific requirements. Things like a driver's license will really make you stand out ahead of everybody. You need to work on your CV. You need to work on your cover letter for you to secure that job that will result in you getting your COS. So the same goes way even if you're in this country. Work on your CV, work on your skills and competencies, work on your cover letter. And guys, we've shared tips, we've shared so many videos that cover all of this. Go on our YouTube channel and do watch those videos, and we wish you so much well in what you're doing. And guys, just know the route is still open, and if there are any changes, we will then update you as usual. Guys, that's all I had for you as far as this new content. I'll see you in our next video, and thank you for subscribing. Thank you for supporting us. I'll see you. Bye.